prostate is a manliness conflict. Not necessarily sexual, but manliness, being the man. And remember, the bodies are designed for survival and procreation. That's it. Really simple. And that's how the body reacts at a biological level. So the PSA, what you call the PSA in the medical world, the prostate specific antigen. So when that level rises, then it's dangerous. It's a number they've conjured out of thin air. It doesn't exist. It never existed.
So it's a way of testing currently, and they look for this PSA to
look
measure...
for the antibody reaction, proteins and blood and all sorts of stuff. Now, there's people in the world who have got PSA numbers that are up in the thousands, perfectly healthy. Now, a doctor will start having concern if a man's goes up 15, 20, that's really high. It doesn't mean a thing. It really doesn't mean a thing. And you can have PSA level rising in the liver and in the mouth and the saliva, and a woman can have it in some sorts of breast cancer. So, but for the man specifically, for the prostate, I just want to talk about the conflicts, the types of conflicts that could cause the prostate to enlarge. And remember, it's to produce more seminal fluid, and it's about procreation. So, and that will affect a man at a biological level, whether it's for him or for his children or his grandchildren. So, for instance, say a man is rejected, especially by a younger woman, the prostate will enlarge. Or if he's going through a messy divorce where the children have been taken away, or he can't have access to the children, his prostate will enlarge. Remember, it's all about survival of the species. Or if, say for instance, he's having a real manliness conflict around his partner, or if he's had the snip, he'll become more feminine. And if a lady's been through the menopause, or on chemo, or on a contraceptive pill with testosterone, she'll become more masculine, more manly, more territorial, and that will threaten his manliness. So his prostate will enlarge to make him more manly. And these are the sort of things. So if, for instance, he wants a child, or even if his children want a child, and they can't have a child, his prostate will enlarge at a biological level.
And will it therefore increase the PSA?
Yeah, totally.
Right, okay, that goes along with the enlargement.
Yeah. And so that's really what it's there for. And when it resolves that conflict, then the PSA level will go back down.
How do you resolve the
enlargement will go back down. It's about understanding what type of conflicts can cause it. So you're working from the symptoms backwards.
Right.
So immediately that conflict happens, and it has to be unexpected. It has to come out of the blue. Like for instance, a guy walks downstairs in the morning, there's a note on the table, his wife's left him for another man. Bang. If he perceives that in a way where he's less manly, or he's not a man, or say for instance the lady's been saying things to him that says, I'm going to leave you, or she's been telling him, you're not man enough for me, he'll get an enlarged prostate.
And of course it's not necessarily the case that the man will be conscious that he's feeling emasculated. It's just, it could just be something that's happening or subconsciously or unconsciously.
Yes, totally.
Through events in his life.
Yeah. And this is this biological reaction that the body sets up, and this what's outside our conscious awareness most of the time. So the most important thing is to look for the conflict, to look for when the symptoms started, and then resolve the conflict, and the PSA will go back down. There's a wonderful story of a chiropractor, and I can't remember what the name is for the type of chiropractor, where they actually do an internal examination. So they actually had this, excuse what's going to happen here, I'll do the I have to do it. So he had this finger up this chap's bum, and he's bent over, as you do, and he could feel the prostate, and it was enlarged. Now this chiropractor was also studying German new medicine.
Right.
And he said to this guy, he said, no, these are the types of conflicts that cause this. And he hit on one, and the guy went, oh my God. and his prostate went down.
You'd actually feel the
on his
prostate,
finger,
the gland.
that quick. And that's how incredible it is.
So sometimes it's just a matter of being aware of what the conflict is, and that's
Sure.
enough to begin the process of remedying the situation.
Oh, most definitely. Or at least diminishing what's going on. And even if we diminish how we feel about the situation, even if we can't change the situation, find some way to soften that situation.
So as a German new medicine practitioner, is that what you do? Do you sit down and talk to the person and investigate and explore what the potential conflicts might be related to their illness?
Yes, definitely. Yeah, definitely, Srimati. What we do is we go back through the case history. So we're always looking for what changed. So if symptoms are there, there's something had to change. So we go back to the time when it changed around your mindless conflict. So I get a case history and I look at what changed in the person's life. Has their life worked out?
So it's not just a medical case history, it's a whole kind of life history that you're looking at. Yeah.
And the important thing is how we perceive what happened at the time. That's the really important part. And Professor Malcolm Law from the British Medical Council, he stated, quite a while ago, even on a BBC programme, and that 92% of testing is inaccurate. That's a colossal number. And the medical treatment can make a man incontinent and impotent. That's not good. That's really not good for a man. I'm a man, and I've always been a man. And the thought of me being impotent,
it would actually make you have a bigger complex.
then you've really got a man on this conflict.
You really would have a man on this
time.
conflict. Yes, yeah. So it would do the opposite.
And the thing is, it's crazy because there's no need to go there. It's just that we don't know this information. That's why it's so important. And why I'm so passionate about putting the information out so people can empower themselves and go, okay, X equals Y equals Z. Now I understand. Go back and diminish that. Simple.
And that's why you're really keen to actually do a set of videos with all the different ailments, just pointing out to people what the conflict, where to sort of look at where the conflicts might have occurred in their lives.
Definitely.
So that they can almost do a
at a practical level.
Remedying. Yeah.
Yes. And again, I have to say this, it's not a medical diagnosis, and any problems, go to your doctor and check it out. But have a think about it, think why these things happen. Just, for me as a man, it's not to be led. I always go to a doctor for diagnosis, and I always tell people, and I won't work with people with a medical ailment without getting a doctor's diagnosis.
Yes, yeah.
9 times out, and they're fantastic at diagnosing.
Yes,
they're really good at that middle piece. Lousy at what caused it, and lousy at how to fix it without suppression through medication or surgery. But that middle part, they're fantastic, and they've got the technology and the equipment. So
it's a piece of the puzzle then.
Yeah, totally.
Yeah.
The whole future for medicine is us working together.
So what would you suggest a man does if he thinks he's got a prostate problem?
Well, if his life lesson for a younger man, find a younger girl. Simple.
Simple.
But apart from that, do your best, guys.
Yeah.
So, if he's got an issue, then get in touch with a German new medicine practitioner, or find something from this and go back and try and find what changed before the symptoms come
and have
on.
a conversation with someone about it, perhaps.
Yeah, of course. And if a man finds, say for instance, got cloudiness or urine in the blood, then get it checked out. Definitely get it checked out. But have a think before you go for any treatment. And believe me, none of this stuff is. Prostate is not life-threatening in any way, shape or form, ever. And Dr. Hammer recommends, and when there's blood or cloudiness in urine or these sort of symptoms, it means that something's been resolved in some way around those circumstances. So the body's actually healing.
That's an interesting
And then they go and do treatment, not good.
So actually, from a German new medicine point of view, when you get extra symptoms, sometimes it's actually in a healing phase rather than...
Definitely.
Whereas that's not the approach we normally take, is it?
We're told from a very young age that when we have symptoms, we go to the doctor and the doctor makes us well.
And stops the symptoms.
Yeah, because, totally,
through
the medication. And every time we put medication into the body, we go back into, we go out of the healing. We can't be in the healing with medication. It's impossible. It's never ever going to happen. It's never happened in the history of man. It's never going to start now.
That's quite a radical. It's quite a radical thought, that, isn't it?
But these guys have, the whole medical model was based on Louis Pasteur's germ theory.
Yes.
And it was started up by the Carnegies, the Rockefellers, the Rothschilds, who just happened to be setting up the pharmaceutical agencies at the time, who put all the money into the medical schools to teach the doctors. Fantastic combination. You get Louis Pasteur, who's a great extrovert personality, and you pay him lots of dosh. I'm not saying that happened, that might not have happened, but hey, we can make a guess. And he propagates this germ warfare theory that we're invaded by these germs on the outside. What happened to us before that 100 years not ago?
Yes.
How did we survive through the species? How did humanity survive thousands of years? I don't know how we did it. We must have all been hiding under the same rock. How did we get by? It's just mind-numbingly.
So it is actually, it's such a kind of radical paradigm shift in terms of how we conceptualise illness, healing and recovery.
Of course. And any homeopath, naturopath, all these sort of people, they'll always tell you when you get symptoms, when you get inflammation, when you get swelling, when you get discharge. Fantastic.
Right.
Fantastic. Help people to diminish the symptoms but without suppressing them, which is what medication does.
And that understanding, that breadth of understanding, allows the person to relax and trust the process that they're going through.
The body's doing what it naturally does.
You can't just be a kind of, I've got the symptoms and that's okay. You have to kind of have the whole context of what the healing journey is, and understand that there is, there's resolving the complex is happening on some level in order for the healing to finish.
Yeah, and get it checked out. I'm passionate getting it checked out properly by the medical people, because that's what they're really, really good at. And then you make a choice what you're going to do about it. And Dr. Hammer recommends also, if the tumour is quite large, then, and by the way, when the PSA level goes up, it doesn't mean to say there's a tumour there. It just means the PSA level's going up. But if it goes up for a long time, and it could be years, eventually there's a tumour, there's a growth. And the growth starts because the body's trying to enlarge these seminal cells to produce more seminal fluid.
To make itself feel more manly, kind of thing. Yes.
Yeah, totally. Yeah. That's what it does. So Dr. Hammer recommends that sometimes you could put a catheter temporarily just to make sure you get the fluid out.
Yeah.
But again, as we're checking these things out, and all I'm doing is presenting knowledge and understanding from a different perspective, so people can think, oh wait a minute, let me stop a second and think of this. Let me hang on a second. Do I want to be incontinent and impotent? Because you can't turn it back. And okay, you can take some tablets to help you in that way, but it's not worth it.
Very interesting perspective.
Yeah. And of course I'm biased because I'm a man.
Well, it's good that you're talking about that issue.
It is, it's great. And we've got to remember that men are territorial, women are social. We get affected in a different way. So, thank you, Srimati.
Thank you, Bill.
And if anybody wants to get in touch with me, they can get in touch with me at www.eftandmatrix.com.
That's www.eftandmatrix.com.
AND-matrix.com.
Right, AND.
Brilliant.
Okay.
Thank you, Srimati.
Thank you. Got the hailstones keeping us